Hi, welcome back. So we're moving from S190 to sections 4 and 10, which have to do with kind of public employees and public employee health insurance and studies and things. So Sue, you want to come up and join us? And I am sorry, Siglowski?
Yes, you got it right. Thank you so much for having me in this morning. This is my first time ever testifying on this committee.
I think so.
So my name is Sue Siglowski. I am the executive director for the Vermont School Boards Association. And before I start discussing the bill, I thought it would be helpful to take a moment to provide information on the governance of Vermont Education Health Initiative, which is VHI, because VHI is affected by S190 sections 4 and 10.
Yeah, thank you so much for doing that.
Sure. So VHI is a nonprofit organization. It provides health benefit plans to public school employees throughout the state. VHI is a self-insured intermunicipal health pool responsible for the design and rating of the health plan. When setting premium rates, VHI takes into account expected claims, expenses, administrative costs, and maintaining adequate reserves for the time that claims exceed premiums. The organization is governed by a 6-person board of directors.
You mean
with
the organization VHI?
Yes. VHI is governed by a 6-person board of directors with 3 board members appointed by the Vermont School Boards Association and 3 board members appointed by the Vermont NEA. Due to the split nature of its board of directors, VHI does not have an official position on S190. I am here today to provide you with the VSBA's perspective on the bill, given that VSBA appoints half of the VHI board of directors. My testimony, as you mentioned, is focused on sections 4 and 10 of the bill. In addition to this written testimony, I have attached our suggested changes to the language in sections 4 and 10 as markup to S190 as passed by the Senate, and that is posted on your webpage under today's date. Before covering sections 4 and 10 specifically, I would like to express agreement with the comments of the Department of Financial Regulation Commissioner that the benefits of reference-based pricing for the qualified health plans should be spread across all commercially insured groups. With that approach, we believe that it's possible section 10 of the bill could be removed entirely as all groups would already be receiving the savings. I will now move on to section 4 of the bill. Section 4 of S190 requires the Green Mountain Care Board to determine the opportunities available through implementing reference-based pricing for the state employees' health benefit plan and the health benefit plans offered by VHI. The current language of the bill requires VHI, along with the Green Mountain Care Board, the Department of Financial Regulation, and the Department of Human Resources to analyze claims for inpatient and outpatient hospital items provided and services delivered to determine the opportunities available and the projected impact on Vermont's hospitals. This requirement goes beyond the role of a nonprofit organization and places a significant financial burden on VHI, which is not covered in its fiscal year 2027 budget. Therefore, we request that VHI be removed from the responsibility of conducting the analysis and that its role in the process is limited to providing the Green Mountain Care Board with access to and an explanation of the claims data necessary to perform the analysis. So those are our comments on section 4.
The commissioner of DFR was in here the other day or yesterday, I don't know what day we did this. And he indicated that this section essentially was not necessary at all. He said, we already have this data, and he literally picked up a piece of paper and said, it's right here. Do you think that this is necessary?
It We do not think it is necessary. We are suggesting that if you do leave it in the bill,
You can take it out of it.
yeah, we would take it out of the bill, but if you leave it in the bill, we have some suggested language changes.
Okay. All right.
Same thing really for section 10. Section 10 of S-190 creates the Public Employee Health Benefit Authority Study Committee. The duties of the study committee are expansive, and it is expected to fulfill those duties within a short time frame. The treasurer's office noted that it did not request this addition to the bill, that the time frame is very short, and that the proposed appropriation is insufficient. And I would also note that the Senate Health and Welfare Committee added section 10 without asking for taking any testimony from VHI or from the Vermont School Boards Association. If this committee decides to retain section 10, we strongly recommend revisions to the membership of the study committee, changing it from various unions and employers, which is what is on there now in this bill, who would be eventual participants, to state level decision makers who have the financial expertise in insurance to perform a meaningful analysis that focuses on capturing the costs and benefits to the state and to taxpayers. Our additional recommendations regarding the study committee are set out in the attached markup to S-190 as passed by the Senate. And they have to do with the report that would be issued by the study committee and the duties of the study committee and the timeline.
May I ask you, and you may not know the answer to this. The treasurer did not request this. I yet to hear anybody who did request this. Do you know where this came from?
I do not know where it came from.
Is it the opinion of VHI that you're not supporting it because you don't know where it came from, or because you don't support the premise of the questions being asked?
I can't give you the opinion of VHI. I can give you the opinion of the Vermont School Boards Association. And it's not because we don't know where it came from. It is because we think that the makeup of the study committee, as I mentioned, is not the right people to be conducting the analysis. And we also think that some of the language in S-190 section 10 sort of presumes that this is going to happen and asks the study committee to have a blueprint for how it's going to happen. And it focuses more on that than on should this happen at all, and analyzing the situation.
So from the perspective of the Vermont School Board Association, from what I'm gathering in all this language is that it's envisioning a day where all publicly funded employees would be combined into one health insurance. From the opinion of the Vermont School Board Association, is that something they would be in favor of, or is that something they would not be in favor of?
I think that's a difficult question to answer right now. This study committee would need to do, that's the reason this study committee exists, is to do that analysis.
I think though it's a question that has been asked and contemplated for many years. Has it been discussed, or there's been no discussion in the school board association? Like, hey, people are floating this idea. What do we think about it?
I think we've been more focused on the current situation and how it's impacting school budgets and the process for statewide bargaining for school employees' health benefits.
Is that why you believe it came up? Is that, you said it's been percolating for a while, and is it because we're now doing this school consolidation that we're, is that the reason the study?
I have no idea where this came from.
I was thinking the same
I
thing.
am not trying to be cagey or anything.
I know,
have
I know.
no idea where it came from. However, I think everybody would agree that for the past several years, there's been talk about, hey, shouldn't we? I think there's a bill on the wall in House General, possibly, that sort of contemplates this same sort of thing. I guess I think it may be trying to get to that.
The
Possibly.
bill on the wall in House General that I'm aware of has to do with the statewide bargaining process.
Which would just be VHI, correct?
Yeah, I mean, I think I just mean in general, there's been a lot of talk about over the years, should things be combined? Should we redo VHI, the collective bargaining process, all of that? So I guess I was just wondering if you had an opinion on any of those previous discussions.
I think the treasurer's office highlighted it well, that this would take a significant amount of analysis, and that would be quite expensive.
The study itself would be very expensive. So there's
There-
money attached.
I think there's an appropriation Senate version of 300.
350?
No, Jen Tarpon legislative
Sure.
council, there was gonna be a $50,000 appropriation, I think that. That funding came. So, but
Oh, 50?
yes, now, but that came out. And I think, I'm not sure what the rationale for the specific number was. But the appropriations committee took that appropriation out and said something along the lines of the extent funds are appropriated.
Okay. Courtney, did you have a?
I was just gonna. Organize
okay.
what I was gonna say what Jen got to, which is it get changed to if funds are available.
Okay. So the Senate's opinion that we keep it in there just in case funds become available.
That was
Leslie?
the appropriations.
Yeah,
committee.
yes.
I think your question is really important, is like going upstream with this section is like, what's the problem? And yes, it may be expensive to have a study, but does it end up saving more in the end? I'm just trying to understand that. Obviously more history than I do, because I don't know. When you said it's been years, I didn't even know that. So I'm just a little wondering how we answer that question. What is the problem that these two sections are trying to solve? And is this how we want to solve it? And in B, it does involve the Green Mountain Care Board. I don't know if, we want to hear testimony from them or not. I'm just a little confused about like you said, the problem that we're trying. I think I understand the problem in a larger sense. Yes, it might be better to commingle all these public groups and it'll be cheaper in 10 years or whatever. Is that worth doing now?
Oh, I guess I like your question of what problem are we trying to solve? Do we think that the system that we have currently is not working?
Right.
I
guess that would be a question for you.
Yes. I could provide you with the handouts that I have about the cost of healthcare benefits and how they impact the cost of education. And I can send, PDF for posting to your website, but Just to provide you with some of the information from here, healthcare benefits for public school employees are approaching $400 million annually. They're one of the fastest growing drivers of education spending and property taxes. FY 25, the increase was 16%. 26 was 12%, and FY 27, 7.3%. And the share of school budgets that these costs are taking up is increasing. So in 2018, it was 10% of school budgets. Now we're at 15, and if the trend keeps progressing, we'll be at 20 very soon. So imagine that 1/5 of school budgets are just for the healthcare costs. That's what we're heading toward. So yes, I think we do think that there is a problem.
Does this solve, does this start, what does this do to help?
Oh, I thought you were passing those around.
Oh, yeah, I'm happy.
Yeah.
Oh, okay.
Yes, that would be great. Lori, did you?
Sorry to interrupt.
I'm good. Has the health, has the educators' health benefits been increasing at a rate, at a different rate than health insurance premiums across the board for other health insurance? I mean, Blue Cross Blue Shield administers, I'm wondering if the educators' health insurance is increasing at higher rates than the other books of business that Blue Cross Blue Shield has. I guess that's what I'm asking.
Yeah, I think that would be a great question for Blue Cross Blue Shield. I can provide you with some information about the actuarial values of the plans. So most of the participants are on the VHI Family Gold CDHP plan. Just to give you an example of how the cost has increased, in FY 18, a family plan annually would it be what it was, 17,394, and FY 27, we're looking at 43,920. And that plan, when you factor in the HRA, the actuarial values are in the 96 to 98% range.
It's an action where you're value. Oh, never mind.
If you lower an actual value, then your premiums go down. Is there a correlation there?
Yes. What they have is a high deductible plan, but the deductible is completely covered by the HRA. So there is no deductible that needs to be paid.
Lori?
I really like the language that you have added under 1B. And I think could start getting to the question of why is this increasing so much and how can we help find a path forward? But I would still love to know how this whole section got in here.
Yeah. To your, you talked about 96 actuarial value.
To 98, yes.
Oftentimes a high deductible plan is less expensive, and kind of the concept of when the member has skin in the game, they're less like you just said, though, that their HRAs are fully funded. Do you think that if they had skin in the game, that perhaps costs would go down?
Yes.
Yeah. Okay.
And that's what the the statewide bargaining process, you know, that there's two sides bargaining. The employer commissioners are appointed by the Vermont School Boards Association, and they have, you know, argued within that process for a little bit of skin in the game, but the final, it's always gone to arbitration both times that this process has happened. And the arbitrator both times has picked the last best offer of the employees, which did not include that.
The arbitration process, can you speak a little bit? We haven't really delved into that in this committee, but I know that there is a particular arbitration process for this.
Yes.
Can you speak a little bit to that?
Yes, sure. So the process begins in April with the parties. Well, I should back up. The process really begins in the fall before the bargaining starts, when the School Boards Association and the Vermont NEA send a letter to superintendents with a collection tool, and huge amounts of data are collected in order to inform this process. And then we both have consultants that look at the data and agree on the sort of the baseline numbers. And then the process begins in April. It will actually begin next April 2027. And it goes through the summer with various stages, including mediation and a fact finder's report. And if the parties have not reached an agreement, then in the fall, they go to arbitration, and the arbitrator is required to pick one side or the other side's last best offer in its entirety.
And this doesn't happen yearly,
No,
and
it depends on how long the agreement or the imposed arbitration decision is for. But normally it's usually 2 to 3 years is the time period.
so the next opportunity for a different results would be for plan year 2028.
It would actually be plan year 2029.
Can you remind me, does the educators' health insurance, is their plan year roll July to July, or are they January through December?
January through
January through December.
Right.
So they would be bargaining in 2027 throughout the summer, not for plan design for 2028, but rather the plan design for 2029.
Correct.
Okay. Thank you. That's fantastic. I appreciate it. Any other questions? Yeah, go ahead, Tiff.
So this doesn't include retirement, correct?
Right.
Do you have an estimate on how much that costs?
I do not have that information.
Do you have information on last year? Because retirees the year before had Blue Cross, a Medicare Advantage, correct? And with Medicare, with Blue Cross winding down their, what do they have now?
I don't have the specifics on that. I know there was a change, and that the treasurer's department would be able to give you the information.
Great.
I think it's Spring Valley,
It is. Health Spring.
something like that.
Something Spring.
Something spread.
School sponsor, that's.
That's something.
No.
Health Spring, maybe.
Health plan, but.
Okay, so it's still an advanced plan. They didn't put them back into traditional Medicare. Okay.
The retired people?
Yeah.
Oh, I know people who were forced off Medicare Advantage. Who were retired. Maybe I didn't understand what they were saying.
Thank you.
Thank you.
Thank you for your
Thank you.
language suggestions. Really appreciate that.
I did have one.
Oh, I'm sorry.
It has to do with what I've heard from some, school board folks about, a lot of folks and families joining on this plan because it's so good. And so do you have any sense of what increase per year is attributable to folks being added to these plans? Do you have any delineation of that?
Move to a family plan, you mean?
Yeah, family plans,
No, I don't have that
there's a
information.
shift,
Yeah.
a shift for folks to be added onto these because wherever they were getting their health insurance before, other employers that are not as good or not getting it anymore.
Yes.
So therefore, like, what's this? And there's an increased cost driver there. Do you know what that is?
I don't know. I don't have a specific number for you.
Would there be a way to find that out?
I could certainly ask. I'll try to find it out. Yeah. I think that would be something that you'd need to gather data from every district probably. So
Yeah, but they probably have
they may.
it. Thank you.
What is the cost share currently as far as employer to employee
For the premium,
for the premium?
it's 80/20.
80/20.
Yes.
Great.
Thank you.
Hi, Colin. You're the other side of the bargaining table.
Not me personally, but the members I represent, yes. Yeah. So good morning. For the record, Colin Robinson, Vermont NEA. Good to be here again. Hearing the questions before and on Tuesday, I feel like I'm about to reveal a big mystery. So hopefully that will be helpful as you consider S190. So first of all, Vermont NEA is the union that represents about 13,000 public school workers, teachers, bus drivers, school support staff across the state. And organizationally been involved in broad systemic healthcare reform efforts for 30 plus years around the advocacy around the creation of Catamount Healthcare, Green Mountain Care, Dr. Dinosaur 2.0, recognizing that Vermonters' ability to access high quality, affordable healthcare is an impediment to all the things our members interact with their students and families every single day. And of course, the ability of Vermonters, including our members' ability to meet their basic needs and afford the healthcare. I also want to acknowledge the work that this committee did last year on Act 55. Just in the VHI pool, that saved $15 million. Just that one act. That
15 or 15?
15. Yeah. Just that one act, $15 million combined with the GMCB budget orders, that was another $10 million. So that's $25 million of savings realized to school boards, taxpayers, and our members, because as Sue just mentioned, our members pay 20% of their premium. School districts pay 80%, bigger number of 80% is bigger, 20%, a bigger number is bigger as well. Getting down to S190, Vermont NEA has been a longtime advocate for reference-based pricing. We've been engaged in conversations with the Auditor's Office, the Green Mountain Care Board, and many of you and your predecessors for over 6 years on the value, starting in Montana with the model there. And that was one of the reasons why back in 2024, we worked with Senator Kitchell and Senator Lyons to get into the fiscal 25 budget a study of reference-based pricing for the two big public sector pools, the Vermont State Employees Pool, as well as VHI, as you've heard about before. Green Mountain Care Board completed that study in December 24, and I'll share that study with the committee afterwards. But the last full year that they had data was 2022, and it showed combined between the two pools at a reference-based pricing Medicare benchmark of 200%. In that single year, it would have saved $79 million. Across the 5.5 years of study, it was over $400 million. And just in the VHI pool alone in 2022 would have been $48 million, or $230 million over the full 5.5 years. Obviously, that's 2022, so we know those numbers would be bigger. So for several years, both Vermont NEA and VSEA have been advocating for taxpayer purposes, for all the reasons for having this conversation, potentially for our pools to be a pilot. So that's why we were excited when S190 looked at the QHP as a potential pilot. We said, well, okay, we recognize that there's a healthcare affordability challenge here. Reference-based pricing is the path we're on as a state. Great, we're on board. We'd be happy to go there right now for everybody. That makes a ton of sense. And if the decision and the desire is to move forward with QHP, let's think about also looking to realize significant gains, knowable gains, because this study for property taxpayers, for the general fund, and for our members. So when S190 was being considered in Senate Health and Welfare, we brought this to them. At that point, there wasn't an interest in going beyond the QHP. So you have the study language in front of you. The study language is essentially intended to be a refresh of the December 2024 study that GMCB did. And it came as a result of our request to say, okay, if you're doing QHP, let's also use and recognize that we have some analysis specific to these two pools that can have real material savings for taxpayers right now. We support the study. That being said, our preference would be to move forward on RBP for everybody on a timeline that is reasonable and practical and is beneficial to all Vermonters. So if the study moves forward, we're happy to see that. If the desire of the committee is to go in a more expansive way that is both going to provide relief to our two pools as well as all Vermonters and employers receiving health insurance through some type of reference-based pricing model, that is great as well. So that's the origin of the study. No necessary changes. I will say, some of the specific language around data, Health and Welfare was doing some stuff on the fly in the final days. I'm looking over at Di there. And I think it was Elena who chimed in about some of the data considerations that Sue was speaking about earlier. And she's basically recognizing when they did their 2024 study, they were using, I'm not exactly sure the data set, but it wasn't the perfect data set. And so the desire was, if we're going to refresh this study, let's use the data directly from the two pools. So that was the intention of that language, I believe. So that's section 4. Going on to section 10.
Can I ask you a question?
Yeah.
Sure. Can I ask you a hard question?
Please. That's why we're here, right?
I hear, your history of reference-based pricing. I hear your advocacy on behalf of Vermont NEA. And this as it pertains to section 4 and reference-based pricing. But, we sort of, first of all, we're all going to reference-based pricing.
Sure.
So
Yeah.
we got you covered.
Right.
But, in this bill currently configured, it contemplates reference-based pricing specifically for the QHP market. And other than taxpayers, let's remove the taxpayer out of your advocacy. Why would I or anyone in this committee or the General Assembly, why would we target savings should we target savings to a collectively bargained group with a 96 to 97% actuarial rating that effectively has no skin in the game? Or should we target it to the people who actually pay almost every single dollar of that $43,000 premium and have huge deductibles that they're actually responsible for. Who, if you were in my position, who would you target reference-based pricing to?
So that's why we supported QHP and we support moving there for everybody. So to be clear, I think, and you all know this because you get the emails honestly more than I do, right? But there's a lot of conversation about property taxes. The 2022 study shows a potential $48 million savings to the education fund. You know, that's nearly 5 cents in potential savings. So I don't necessarily see it as an either or.
Have we done a study on if we changed the plan, the savings,
So
and made the benefits equivalent to other qualified health plans? Have we done that study? And how much it would save the taxpayer?
the short answer is I think that potentially is some of the things that Section 10 could be looking at, right? What are the potential opportunities in savings there? I will say, you know, VHI is in the process, the VHI board, to articulate the composition of the board, is in the process of plan redesign right now. And that will have an impact on what the future of the plans look like for our members, as well as potentially the costs therein. I don't want to mix my testimony in this moment with the bargaining side of things, because I want to be very clear. How we collectively bargain as a union with our employer over the benefits our members receive is impactful. It's impactful on our members. It's impactful on school boards. It's impactful on everybody. The problem that we're looking to address, and I think your committee has done tremendous work trying to address, and the CARE Board and others, is a healthcare affordability crisis for all Vermonters. There's nothing unique. And VHI co-trust administrators, Bobby Jalsals and Mark Hage, provided testimony to Senate Finance. I believe they've been in this committee before, talking about how the main cost drivers in the VHI pool are no different than any other market that you've heard about. And so the underlying fundamentals are not going to be changed by the contours of how the bargaining process plays out. What is going to have the most substantial change are some of the reform conversations that you've been leading on and that you're continuing to have. So if you want to target, if you choose to target QHPs, as I said in Senate Health and Welfare, as I started by saying today, that's great. We're supportive of that. If there's an opportunity to realize some of those savings more broadly for all Vermonters in whatever way they receive their health insurance, that's great as well. We wanted to provide as an option for the legislature to say, okay, if you want to do something that is going to specifically address a property tax, and the commissioner of DFR, I think, sort of alluded to that as well in his testimony, you know, this could be an option. And so that's the origin of the Section 4 study. Maybe that didn't answer your question, but okay. Thanks, Benny. I appreciate it. Section 10.
Yes.
Okay, so Section 10, the origin. Where did this come from? Where did this come from? I do.
Oh.
So Senator Lyons approached me and said, hey, what would you all think about doing a study on a big public sector health insurance pool? And we said, sounds good. Let's talk about it. And so we had some conversations about it. And that is essentially the result of Section 10. To the history of this general conversation, as Chair Black was alluding to, we were first approached, I believe in 2003 or 2004, by then Senator Jim Leddy, asking about a big public sector worker pool. Our understanding is this is the first time an actual study would be done. It's never been analyzed. It's never been looked at fully. And I will say, I know it was mentioned earlier, I think how you operationalize something like this is fundamental to a study. So it's not just the various components of it, but it's actual, how do you get from A to B? So that's kind of the quick headline. Obviously, as the language references, it references Oregon and Washington State, because those are two states that have moved in the direction of large public sector worker pools. And so there's opportunity to learn from and build upon those types of states. We've talked with the Treasurer's Office, and we're supportive of their recommendations that they presented on Tuesday to adjust the language in Section 10 and are comfortable with that. And I want to emphasize one final potential opportunity about Section 10. Recognizing the breadth and scope of it is significant. It's not just the opportunity to have a bigger pool that could potentially afford opportunities for savings, but there's also an opportunity to use that pool to drive innovation, right? Through things like direct contracting with centers of excellence, through other types of next-gen PBMs and methodologies where that large pool could use its weight to drive some innovations that can be beneficial for everybody. As it relates to the composition of the task force, obviously I had not seen the VSBA's testimony until just now. I will say the composition of the task force is very intentional in that it has 5 members representing employers and 5 members representing the public sector unions that serve within the state college system, the University of Vermont, the state of Vermont, as well as obviously public schools and municipalities. Those are the 5 unions that are represented there, and you see that mirrored in the employer representatives. I would hope you can appreciate that whenever you talk about, especially if we're talking about rolled up here, maybe 100,000 lives, 80,000 lives, when you start talking about these types of matters, it's very, very important to have the directly impacted stakeholders at the table for those conversations. And I think there's enough expertise and understanding and passion to kind of dig into this in that extended timeline with some of those additions that the Treasurer's Office recommended, that we could get a good start on starting to understand what is the opportunity here for Vermonters with this type of larger pool.
When you talk about stakeholders with 100,000 lives, who are you talking about as the stakeholders?
Well, as contemplated, yeah.
I mean, I see that you have representatives.
Yeah.
So you have representatives of both the employer and the employees.
Yeah.
Do employees in the small group market get a seat at the table in their plan design?
You know, I don't believe so. I mean, right? You know, I assume that was sort of a rhetorical question.
Talk about self-funded.
Yes.
I mean, I'm trying to think in what world do employees get a seat at the table in the plan design other than collectively bargained?
I mean, fair enough. And I would say as our members, as well as, you know, the other unions that are represented here, have been engaged and come together to engage in those conversations with their employers for decades. And so if there's not here's the thing, if there's not a desire to explore this as a potential savings opportunity or innovation driver, that's fine. You know, we're coming to the table here saying this has been something that's kicked around for 20 years. We're ready to have that conversation. We recognize it's a hard conversation for our members, recognize it's a hard conversation for Vermonters. And at the same time, it's worth finally taking a look under the hood. Now, is that a different construct than may exist with people? Yes. But we represent Vermont NEA, and in this particular bill is contemplating public sector workers who are unionized, who do have a different relationship when it comes to the relationship they have with their employers as it relates to their healthcare benefits. I think there's great value in that for workers collectively. And I would say every worker should have an opportunity to join a union and be engaged in that conversation.
I'm really pleased to hear you say that you look forward to having the conversation. Karen.
Thanks for being here. So I really am very much interested in looking under the hood and seeing where, you know, where this information leads us and where results in reducing costs and providing quality healthcare could be what we end up with. And so I have a couple of thoughts about that the cost drivers in these larger groups are no different than elsewhere. One is that there is the actuarial fact that there's no obligation to actually pay out of pocket. So it's very attractive to be in these plans. And so folks try to get on them and increases the numbers of folks that are on the plans. And then does that not increase utilization? If I can go get this great healthcare coverage for free, why wouldn't I? And then, so that's utilization. And then there's this obligation that we as a community and state taxpayers and so forth provide this. And I think there's a sort of a funding source for it, unlike regular books. And so, I believe teachers should have healthcare. They've bargained for it. When they started bargaining for it, maybe they took lower salaries and they had no idea health insurance would do this. And yet, despite all of that good things, I think it is not wrong to think about this scenario as a cost driver contributor. The way this scenario ended, it is actually a cost driver and it shifts a lot of the burden to other folks, and not intentionally. And not because they don't have bargain for rights. So we're a little bit talking about healthcare as a, public good that everyone should have access to, and not some folks being left out. And we've talked about maybe 5% initially, all folks getting healthcare going into a pot that would fund everyone having access to primary care at a reasonable rate. And not so burdensome. What do you think about that?
I'll answer your direct question first and then get back to a couple of points that you brought up that I feel want to address briefly. We support single payer. We supported the efforts for Green Mountain Care Board. We supported and led the effort on Dr. Dinosaur 2.0 to create universal health care for all Vermonters age 26 and under. If the next step on that train is universal primary care for all Vermonters, sign us up. Yeah. So to your other questions, I do want to spell a quick piece of information here. It's not the terms of the statewide healthcare agreement outline how deductibles are covered for public school workers, whether paraeducator, bus driver, food service worker, school counselor, school English teacher. And it covers first dollar of the deductible. That's the structure of the health reimbursement arrangement. It does not cover every dollar of the deductible, but it is first dollar. And as you heard from your witness earlier, when it comes to HRA funding, obviously, for budgeting purposes, you're not budgeting the full exposure. There's analysis done to figure out how much needs to go into that account. It's HRA, so it rolls over. It stays employer dollars. When our members leave, it's not an HSA. They don't walk away with that. It doesn't go towards the healthy and wealthy. You can use it to buy a boat when they turn 65, right? It stays with the taxpayers locally. So there is there. I would encourage the committee, if you want to spend some more time on this, and I forget when the last time you had the VHI co-trust administrators in here, but they have a really comprehensive presentation on VHI, the VHI pool, the experience, utilization, all of those things. The last time they were in, I think, was in Senate Finance on February 6th. Anyways, I think there's a lot there to unpack And I don't want to misstate or mischaracterize, and so they would probably be the best to kind of speak to some of those questions around utilization. They have a very comprehensive,
And I think we had them in earlier last year.
yeah, I couldn't remember
I
exactly.
can check it.
Yeah. Yeah, no, I'll send it to you as well. I can share it with,
Can you send it to Tasha?
I can send it to Tasha.
Any other questions? We've run out of time. Oh, sorry. Yeah, no, go ahead.
You may have answered this question, and I'm sorry if I missed it, but it was suggested that section 4 is redundant by the Green Mountain Care Board and DFR, and that we didn't need it. So I was wondering if you had any thoughts about that.
Good question. I'll say it this way. We did not request section 4. Section 4 was sort of, I would say, maybe a release valve from a conversation about other things related to reference-based pricing. And so if there is a desire to go a different direction, I think that would probably be okay with us. I do think what the study would show is continued and significant savings potentially realized in these 2 public sector worker pools for taxpayers.
So we could just go ahead and do it, which is what's being suggested.
Correct. And we would support that. If you just go ahead and do it, there's no need for a study.
There you go.
However,
I would, with an asterisk.
Everybody.
Yeah, don't you think that would be pretty unfair to what we're doing to like the whole education system already? And then we're just gonna say, and by the way, your healthcare system is going to enough people at the same time. I don't know, I just feel like we're doing, well, I like the study. I'm a public sector employee, so.
Yeah, no, I know.
You like the study in section 10, not the study in section 4, we.
Section 10 I like,
It's
yeah.
just a
Yes.
actuarial analysis that is
Yes.
being done all the time.
Yes,
Thank you.
Yes.
thank you.
I was gonna, Christine previous, I was gonna ask you all sorts of administrative, like, questions and costs on that, but I won't.
I'm always happy to come back.
I don't want to get into
Always
that.
happy to come back. And if you want to talk more about the bargaining side of things, I think that's outside of the scope and purview of this committee, but I wouldn't say we would happily go there, but happy to explain the contours of that.
Thanks, Colin. Always good to have you in here.
See you too. Thank you.
All right, we can go off of live and we are back here after the
you doing?
today, 15 minutes.